Welcome to our channel. Today, we have the following news. Zhao Lusi personally clarifies medication controversy. Zhao Lusi recently stepped forward to personally clarify the controversy surrounding her use of medication, but in doing so, she also opened a much broader conversation about mental health, particularly the often misunderstood phenomenon of somatization. Her story resonates with a familiar yet confusing experience that many people have faced: recurring headaches, stomach pain, heart palpitations, or unexplained fatigue that persists despite repeated hospital visits and thorough medical examinations, all of which ultimately conclude with the same frustrating result: everything is normal. At first glance, such symptoms may be dismissed as overreaction or even imagination. However, medical experts emphasize that these physical discomforts are not fabricated. Instead, they may be the body's way of expressing psychological distress when emotions can no longer be processed or articulated in a direct way. This process is known as somatization, where mental suffering manifests as physical symptoms. In simple terms, the mind speaks through the body when it cannot find another outlet. According to specialists in psychosomatic medicine, somatization can affect nearly every system in the body. Some individuals experience cardiovascular symptoms such as chest tightness, rapid heart rate, or sudden palpitations, symptoms that Zhao Lusi herself once described. Others may suffer from digestive issues like nausea, bloating, or loss of appetite. Neurological effects are also common, including dizziness, headaches, numbness, and the increasingly recognized brain fog, which affects memory, focus, and cognitive clarity. In some cases, even the skin and musculoskeletal system are involved, with recurring allergies, eczema, or shifting pain that moves unpredictably from one part of the body to another. What makes somatization particularly distressing is its elusive nature. Symptoms often appear, disappear, and migrate without clear patterns, leaving patients trapped in a cycle of medical consultations across multiple departments: cardiology, gastroenterology, neurology, without ever receiving a definitive diagnosis. Studies have shown that a significant majority of patients with anxiety-related conditions initially seek help from non-psychiatric departments, highlighting how easily psychological issues can be misinterpreted as purely physical ones. From a scientific perspective, this mind-body connection is deeply rooted in how the brain processes stress. When a person is exposed to prolonged emotional pressure, the brain's alarm system, particularly the amygdala, becomes overactive. It continuously sends danger signals, even in the absence of real threats, keeping the body in a constant state of tension. This triggers the release of stress hormones such as adrenaline and cortisol, maintaining a prolonged fight-or-flight response. Over time, this imbalance disrupts the neuroendocrine system, weakens immune function, and interferes with digestion, further reinforcing the physical symptoms. Zhao Lusi's personal ordeal brought this invisible struggle into the public spotlight. Before addressing the issue openly, she had already been photographed in a visibly weakened state, requiring assistance and appearing unable to hold her head upright. Reports later revealed that during the most severe phase of her condition, she experienced significant impairments in speech and mobility. Even more troubling were allegations about how her management handled the situation, prioritizing damage control over proper care and isolating her under the pretext of avoiding negative publicity. Such revelations expose the harsh realities of the entertainment industry, where artists are often treated as commodities rather than individuals. Grueling schedules, lack of autonomy, and immense public scrutiny create an environment where both physical and mental exhaustion become almost inevitable. Zhao Lusi's experience is far from unique. Other public figures have also spoken out about similar struggles, from emotional breakdowns during performances to long-term battles with anxiety and depression, all of which point to a deeper systemic issue. In recent years, somatization has increasingly been recognized as a silent epidemic, particularly in high-pressure environments. Despite the growing awareness, many people still hesitate to seek psychiatric help due to stigma, often finding it more acceptable to report physical symptoms than emotional distress. This cultural bias further complicates early diagnosis and treatment. Experts stress that recognizing somatization is the first step toward recovery. When persistent physical symptoms cannot be explained medically, psychological factors should be considered. Treatment typically involves a combination of psychotherapy, especially cognitive behavioral therapy, and, when necessary, medication prescribed under professional supervision. Equally important are lifestyle adjustments, including maintaining regular sleep patterns, engaging in physical activity, and practicing stress reduction techniques such as mindfulness and controlled breathing. In her heartfelt statement, Zhao Lusi explained that she had long avoided speaking about her condition out of fear that it would be misinterpreted as a publicity stunt. However, she ultimately chose to share her experience to raise awareness, emphasizing a crucial message: depression is not simply an emotion that can be overcome with optimism, but a genuine medical condition that requires understanding and treatment. Her honesty has struck a powerful chord with many who have silently endured similar struggles. By bringing the concept of somatization into public discussion, Zhao Lusi has helped people recognize that unexplained physical pain may not be a sign of weakness or exaggeration, but rather the body's most honest cry for help when the mind is overwhelmed.